What is quick recovery breast augmentation?
Hi, I'm Dr. Joe Gryskiewicz. They usually call me Dr. Joe or Dr. G, and I'm a board-certified plastic surgeon. And I'm going to try to answer the question, what is quick recovery breast augmentation? There's been a lot of bad press about that, in a sense, but this is actually a scientific method that's used to help patients get back to their daily routine faster, get back to work faster, which means more money, and get back to their kids faster. So here's how that works. It's published in our journals, and there's studies to show patients get back to daily activity the day after surgery 95% of the time. And this is done by preparing patients preoperatively and then doing certain maneuvers during the procedure and then having a post-op routine. And you can see here there are many references that talk about the quick recovery approach. Involves things like gentle traction on the tissue, never touching the ribs with metal, putting anesthetic into the pockets at the end of the procedure, and avoiding wraps and bras and drains. See, for example, if a marathoner finishes a race and lays down on the boulevard and doesn't stretch, they're not going to be able to move the next morning. And that's how it is with stretching the pectoralis muscle or with having surgery itself. If you get moving, you feel better and recover faster. So actually, since this is published in our scientific journals, this isn't a gimmick. These are peer-reviewed journals that are edited. This is not marketing hype. It's a real thing, and we've seen a difference in our patients, and I've published on this, where we had 95% of our patients get back to normal daily activity the day following surgery, where we looked at several thousand patients. And we have a book of testimonials, and this shows what patients experience after the surgery, where they might go to a game or dinner that night after surgery, or they're back to bring their kids in the office the next day, carrying their twins around who weigh 30 pounds, things along those lines. So again, I hope this helps you understand that you can expect a quick recovery most of the time after your procedure, and be sure to see a board-certified plastic surgeon who's a member of ASAPS or ASPS. So you can see from these two still pictures that patients are doing their arm exercises the day after surgery, and these two patients in particular happen to have a small little armpit incision. And then you'll see two videos of a patient who had the dual plane augmentation with the incision under the breast, and then another patient who has the armpit incision doing their arm exercises 24 hours after surgery. So I hope that helps you understand a little bit that you can expect a quick recovery in most cases, not a guarantee, but this is also called the flash recovery or rapid recovery, and this is the practice that we use in our office, and I hope that helps you in terms of understanding that. Thanks. This shows an inframammary dual plane breast augmentation patient doing her quick recovery arm raise exercises 24 hours post-op in our clinic, instructed to do this 3 times an hour while awake. This shows a quick recovery breast augmentation patient doing her arm exercises after an axillary breast augmentation 24 hours post-operatively in our clinic.